I'm Asaki Matsuzaki, a psychiatrist. Today, I'd like to talk about some common misunderstandings surrounding panic disorder. Mental disorders are often accompanied by misunderstandings, and panic disorder is certainly no exception to that. I came across a paper that addresses such misunderstandings, so I'd like to briefly introduce what it says. Some people with panic disorder dislike receiving a diagnosis of panic disorder and may try to avoid seeing a psychiatrist because of that. Some people experience intense fear that they might be losing their mind during a panic attack, even when they're not having an attack. Some people avoid seeing a psychiatrist because they fear that the psychiatrist might see through them and point out what they think is madness.
Also, physical illnesses are generally easier for others to understand, and people tend to show more empathy in those situations.
That's why some people with panic disorder don't want to believe they have it and instead keep visiting internal medicine clinics in hopes of finding a physical cause. People with panic disorder may sometimes show visible fear during a panic attack, or they may try to avoid situations that could trigger one. Such behavior can lead others, or even the individuals themselves, to view them as weak. Strong anxiety may be mistaken for a timid personality and misunderstood as a fixed trait that cannot be changed. These misunderstandings can become obstacles to receiving proper treatment. In treating panic disorder, anxiolytic agents and antidepressants are often used, but some people feel resistance toward these drugs, fearing they might change their mind or personality. When it comes to benzodiazepine anxiolytics, because the casual or excessive use of benzodiazepines has been widely regarded as a social problem, even their appropriate use is now often avoided in many situations. Some people also fear that receiving counseling might lead to being brainwashed. Misunderstandings about panic disorder held by the individual or their family can become obstacles to receiving proper treatment, which is a serious issue. Social misunderstandings, as well as the individual's own misconceptions, can also interfere with daily life and social functioning, which is another concern. And simply continuing to carry negative misconceptions can itself be a source of distress, which is also a serious concern. So that was a discussion on the misunderstandings and stigma surrounding panic disorder. It's important to explain these things one-on-one in the consultation room to someone with panic disorder. However, if we want to change society's overall perception, then people like myself, those in a position to share information with a broader audience, need to make a conscious effort to address it. And I also hope that each of you watching this can help spread better understanding to those around you. I was invited to speak at the Japanese Society of Anxiety and Related Disorders, May 25th, 2025, where I was given the opportunity to talk about public education on anxiety disorders, so I took the time to study the topic in my own way. That's all. 8.